Mgeni wetu anaongea kwa lugha ya Kiingereza, lakini tutakuwa tunawapa tafsiri kwa kusoma kwa hapo chini kupitia luninga. Dr. Stefan, thank you so much for coming. And what we're talking about is the Open Government Partnership Initiative. We're looking particularly in your interest for the medical department store and how that would actually help in opening up the government and opening up even the activity of the government, making it more efficient and more accountable. Your organization has had a lot of experience. You have worked in Kigoma, you've worked in very distant areas that are very far from the major city of Dar es Salaam. What are the problems that you encounter when it comes to the medical store department, and how do you see this initiative helping move things forward?
I think we have seen very many problems, particularly affecting maternal mortality, because as a gynecologist obstetrician, I am sort of directing an activity which is nationwide but focusing on 3 regions, Kigoma and Morogoro and Pwani regions, and there we have had big problems. We are training assistant medical officers to do surgery, cesarean sections, to save mothers' lives where there are no doctors. In Kigoma, there is 1 doctor in 3 million people. It's impossible. So we're training the assistant medical officers, but they are again paralyzed again and again and again because shelves are empty. There are no sutures, there is no anesthesia drugs, there is no gauze. We have 0 activity in cesarean sections, and mothers are dying because there is no gauze on the shelves. Gauze is a cotton product. It's not even expensive, but mothers are dying because the medical stores department cannot provide us with gauze. And of course this is, I think, a scandal, because why should we upgrade health centers? Why should we train assistant medical officers and nurse midwives to provide life-saving skills if they are again and again frustrated by stock out of these simple things? And we can document month after month after month that these health centers in the periphery, they have not the necessary drugs to save mothers' lives. In this country, something between 7,000 and 10,000 mothers die a maternal death every year. And something in the range of 90 to 100,000 babies die because of this. So if we can make minimum efforts to make something about that, and we try to do it because we open up health centers in Kigoma, Morogoro, Pwani, in distant, remote rural areas, hard to reach. But we are frustrated because this medical stores department cannot be reached with the message that please provide the necessary life-saving skills. Now we have given up in some centers, and also very important, you know, the health workers are very low, have very low salaries. Often they are not paid when they are up night time. They are not given any call allowances or hardship allowances in many districts because there is no budget for that. And then on top of that, they can see a mother die or newborn babies die because of empty shelves. And this, of course, for us, sort of trying to help and to try to support that by training and by equipping and by motivating and by supporting. We are also stuck because of that, and it could have been much better than that. And
but what do you think about what they're proposing now? That what they're saying is the medical stores department has to actually publish and put it publicly. Is this something that maybe you have also considered before? Do you think this could help?
This should have been a reality a decade back. I cannot really see why now there is sort of quote-unquote transparency needed. This is the need to save women's lives in this country. Why is this an issue 2012? I can't understand that.
Well, again, the initiative is quite new in this sense, although, as you said, some of the initiatives should not have been new. This is a way of trying to get it together, but just to because the numbers you've said are staggering. When you're talking about the shelves being empty, and you've given us examples, what are the reasons that you're given? Why are you not getting them in Kigoma, in Pwani, and in all these areas? When you do go to the medical stores department, what is the excuse?
There is, we have had representatives from the medical stores department in our summit meetings a couple of times, and the explanations they give are very little convincing. We have also Tanzania specialists in the audience, and they are also critically negative to the explanations given. For instance, gauze, cotton. This country produces cotton, doesn't it? And now they said in half a year ago that this is a very tricky thing because our Tanzanian cotton is not good enough to absorb blood. I do not believe that the cotton from a country like Tanzania with 43 million people cannot produce cotton enough to produce gauze for us to use in surgical work. Now they said they had to import cotton from India in order to produce gauze, and this seems to be so far-fetched. We can use very simple kind of gauze material to make women survive, but they say we must import, and that is hard currency. So believe it or not, he said that cotton must be imported using hard currency, and of course this is an explanation if it is true, because hard currency is a scarcity. That goes without saying. But I cannot believe that the organization in this country could not produce gauze. It's unbelievable for me in a cotton-producing country.